and allow yourself to be human in this pursuit. Since we are here just 2 weeks, oh my goodness, 2 weeks from Christmas Eve, I do want to just mention something about traditions. One of the things that can really get us overwhelmed with regard to holidays, even in the before times, is maintaining traditions. And now, when we're all facing the reality that we'll probably have a very different kind of Christmas or kind of holiday season, however you celebrate, we might want to take stock of traditions and recognize, first of all, that maintaining them does contribute to stress. So, when you're looking at the kinds of traditions that you would like to maintain, think about why the tradition is important and to whom it is important. I always loved the story about the family that cut the end off their holiday ham, and the next generation was inheriting that task. And the young woman asked her mother why that was true, and she said, "Well, I don't know. We just always did it that way." And they went up the line, and the great grandmother was fortunately alive, and someone asked her, and she said, "Well, it's just because the pan wasn't big enough for the ham we had at the time." Somehow that got adopted as a tradition, and that always makes me laugh because I think about things that are handed down almost as if they're a gospel truth, and then it turns out that it was just something that was a response, a practical response to a problem in the moment. So think about those traditions and think about, are you honoring somebody by keeping a tradition? Do you think it's important to the person you're caring for? Is it important to you? And then choose among the things that are most important. Prioritize a few. Think about the ones that are really going to mean the holiday for you. You might have to reframe or postpone some of the other ones. I'm hearing about people talking about Christmas in April and Christmas in July, and we're going to save all the gifts and just wait until we can get together, even if it's at a picnic table with the grill going, whatever. The time will come when we'll be able to get past this. For most of us, unless we have had the sad experience of someone being very ill or losing someone to the coronavirus, the pandemic is an interruption to our activities. I made a comment not too long ago, and as Christina shared, I'm a longtime member of the Frederick Chorale. Every year at this time, I would be scurrying around doing Christmas performances, and that's not happening. And I said, here we are, it's taken a pandemic to stop the tradition. And a friend quickly said, no, it's just an interruption. And that really helped reframe it for me, because next year, with a vaccine in place, I am hoping that we will be right back to doing the things that we love to do, whatever those are. And for me, it's singing at the holidays. Okay. So going back to the general day-to-day idea of getting caregiving help, there are a number of sources, if you will. I would encourage people to think about the family and friends that you might have who maybe sometimes offer to help, or that you feel you can call on, or even if they're people that you're not sure you can call on, maybe it doesn't hurt to ask. And this doesn't have to be the primary caregiving responsibility. If your loved one wouldn't like it if someone they don't know very well, or someone who isn't you, was doing their personal care or some other more intimate tasks, then don't try to get somebody to help with that. But maybe there's someone who can run the errands, who can take care of the pets if you have pets, who can bring in the groceries or mow the lawn, or whatever all of those practical things are that just have to happen for life to continue in the way that we want to live it. If you do find that you need to turn to more professional sources, we have two great resources here in the county that are specifically focused at caregivers and seniors and adults with special needs. Maryland Access Point, or MAP, at the Senior Services Division is one of them, and Joy Rowell stands by day in and day out to help connect you with services and resources, and she really is an expert on the things that are available to provide the supports that you may need. Adult Evaluation and Review Services is at the Health Department, and their service is available not only for elder citizens, but also for anyone over the age of 18, so an adult who has special needs and needs daily care. And they can have a nurse or a social worker come out to your home environment and meet with you and the person you're caring for and talk about what your needs are, what your interests are in terms of getting help, and connect you with resources. And there's a great flow of information among these organizations with permission of the people who are looking for the help. And then there are also a number of other community and professional resources. You saw the Right at Home sponsorship spot at the beginning, and they are one of the longtime providers of care, and there are a number of others. An Elder Service Provider Council can be a source of information about those other providers to connect you with the resources that you might need for day-to-day tasks to help you keep your loved ones safe and well cared for. Sometimes, despite all the care, the caregiver stress remains. And sometimes you don't have access or you don't think about calling these other sources, but you're feeling like you're at the end of your rope. And then where do you go and what do you do? So this slide is all about you, caregivers, although you certainly might access information for your loved one that you're caring for. But the first thing I would say is see your doctor for your routine and urgent care. Often the caregiver will be the one that will skip the appointment for themselves in favor of taking their loved one to an appointment. And maybe you can get away with that a time or two. But if you need your medication to be adjusted, if you have a new complaint that needs to be examined and diagnosed by the doctor, if you have caregiver stress that's causing some of those problems I talked about earlier, and you haven't let your doctor know, it's probably time to do that, to open up with your doctor. I was really encouraged when a few years ago my own doctor started asking questions about my mental health, whether or not I was having symptoms of depression or anxiety or stress. That helps complete the picture. Really, we're all one being. Our mental health and our physical health are connected to each other, and your doctor can be a good starting point for you. Maybe they have the solution, or they can refer you where you can find a solution. Particularly now, as we're dealing with the pandemic, but I'm hoping continuing in the future, we have the option of telemedicine, and there are certainly a number of complaints that can be really well dealt with via telemedicine, and it doesn't require you to leave your home. It does require some technology, I understand that, and that's not easy for everybody. But if you have the opportunity to use telemedicine, that can be a way to get some of the care that you need, or to find out whether or not you need a higher level of care for yourself. The Mental Health Association, as I mentioned, has programs for the lifespan. 211. So I know at the beginning, Christina asked in the poll question about who has access to the Mental Health Association or 211. So let me tell you a little bit about that. 211 is one of the lines that is answered in our call center. It is available 24 hours a day, 7 days a week, 365 days a year, as are all the lines that we answer there. But 211 is certainly the easiest number to remember. And if you call 211, there will be a call specialist available who can talk with you about what your concerns and your needs are. And if what you want to do is have a conversation and just sort of sort out your thoughts, that's one option that they can provide. But if you need information and referrals to agencies or providers of care, they can also help you with that. And the same is true of the Frederick County Hotline. The Frederick County Hotline number that you see there on the screen is the one that sort of started it all for us back in 1985. And that also rings into the call center, and similar to 211 line, is available 24 hours a day, every day. We don't even close for blizzards. We have a hardy crew who come in and basically camp out in the call center when the weather rages. So both of those numbers are appropriate to use to get connected, or even if you're just feeling stressed and you just think you can't go on for another minute and you need to talk to somebody and you don't want to reveal these things to your best friend or to your adult child or your sibling. You just someplace you want to be able to say things and get them off your chest. This is a place to do this because the calls are confidential, and we're there to listen and help when we can. Sometimes seeing someone in person is the real magic solution, or at least the starting point. And the Mental Health Association offers walk-in crisis services. Now, when I say crisis, I'm talking about anything that is upsetting enough to you that it's interrupting your ability to handle your daily activities, or make you less able, feeling less able. So for walk-in crisis, you can see the hours there. Monday to Friday, we're available from 10 a.m. to 10 p.m. Saturdays and Sundays from 10 a.m. to 6 p.m. And the service can be reached in two different ways. You can simply come to the Mental Health Association at 226 South Jefferson Street in Frederick. Come to the main entrance and let the receptionist know that you want to see someone, you want to talk to someone. And there are crisis specialists there to do exactly that. Since the beginning of the pandemic, we have been offering telemedicine services for these appointments. So you don't even have to come into the call center, or I'm sorry, you don't even have to come into the Mental Health Association office to access them. And on our website, there is a portal to help you get to the link for the virtual walk-in sessions. So these services are available to anybody in Frederick County who needs a little extra help. And actually the call center is available to all of Western Maryland. We service every part of Maryland from Frederick through Garrett County. So people can be calling from there if you have loved ones out in that region. Go here. So here's our contact information. Maybe there's some way that this can be shared out, Christina, I'm not really sure. But we are available on the web, and you can reach us there at www.fcmha.org. And our main phone number is 301-663-0011. But really the shortest way to get to us and the easiest number to remember, I think, is 211. So thank you all very much for listening to tonight. And I'm going to stop my screen share here and turn this back over to Christina.
Hi, everybody.
Hi.
Linda, thank you. That was excellent, really timely, and some great information. Folks, we are happy to take some questions. If you have any questions for Linda or anything about senior care in general, we are happy to have them. Linda, while you were talking about 211 and the walk-in clinic, is it like going to the doctor's office? Am I going to have an insurance card and all my personal information? How does that work? What can I expect if I call or if I walk in?
Okay, if you call, you can be completely anonymous if you want. Although I will say that if you're looking for a resource, they're going to need to know who you are so that they can send the resource to you. They can read it out over the telephone, but there's also an option to email. If a person comes to the walk-in service, all of these services I just described tonight are free. So an insurance card is not required. You will be asked to fill out an intake form when you come to walk in, just basically so that the crisis specialist has an understanding of what your issue is. I will say, and there's one part of that crisis service that I did not mention, and that is our counseling services. Mental Health Association provides counseling services just like many other therapy offices throughout the county. We are different from some of them in that we accept Medicaid, Medicare, and we also have sliding scales so that the amount paid is based on a family income. So this is a good resource for folks who maybe don't have a lot of resources, don't have a good insurance plan for mental health care. And that too can be accessed again. 211 really is sort of the pulse point, how to get to us and find out if you have any questions about our services. You can call 211 and ask, or just let them know what your concern or issue is. And the folks who will answer the phone are well trained to give you the kind of information that you need. But they're also there to help with addressing your concerns in terms of if you're feeling in a crisis at the moment and you just need to talk and have somebody to be supportive, if you need somebody to help you walk through some problem solving, just to think about options on how to address things. And I will say we have a great relationship with both AIRS and the MAP program. And if we don't have an answer for you, we are happy to share you with Joy and the folks at the health department, because at the end of the day, the right answer is the one that works for the person who is giving us the call.
We are really blessed, I think, to live in Frederick County because it is an incredibly tight-knit service group of providers who we all know each other. We're all here to support you as the caregivers and the seniors, and we really want to help. And I certainly appreciate everybody knowing each other, and we know we can call and help connect somebody to the help that they need. I will say I have called 211 before, and it is a fantastic resource when you are just feeling overwhelmed or not sure. And as Linda said, just need a completely unbiased person. It's a really great way to just talk something through. It can really bring a lot of relief. So it is a great service. Linda, when does a caregiver, what are some of those signs? You talked about a lot of things, but really that really someone needs to be mindful, or the friend of someone needs to be mindful that their needs are really becoming professional needs, right? That it's not so much talking to a friend or having somebody do the errands. When does somebody know that they really should try professional help?
Yeah, so I kind of think about that as how intense and how long the difficulty is. So if you have an event, kind of one day you need to get your loved one to a doctor's appointment and the car won't start. That's frustrating, but when that problem gets solved, that stress is resolved and you go on. But if you have problems, either different kinds of problems that are causing you stress day after day after day, or one or two major things that are unresolved and causing stress for a long time, and you find that you're not feeling happy at all, you're not able to enjoy anything about life, you start feeling resentful toward the person that you are caring for, and you turn your anger toward them. You're feeling unwell physically yourself, but you can't really put your finger on what the problem is. Those are the kinds of things that I think are red flags that really maybe need some attention. And one of the reasons that I brought up your doctors as a source is because a lot of us have relationships with our doctors, and we trust the confidentiality of those relationships. I would hope that people would feel comfortable calling 211,
Mm.
but I can understand that that's a different kind of a service. And so if 211 feels a little different for you, call the doctor. Although I will tell you that we do get referrals from doctors' offices. If someone goes to the doctor and the doctor is concerned that are having some significant, maybe early signs of some depression or anxiety, they might suggest that they come over to walk-in and talk to somebody whose specialty is mental health. And I would invite you to think about that too, that what we do at mental health is like a specialty service for mental health. And while doctors can be very good about a lot of things, they don't have the time to be mental health experts.
No, you make a great point that it really is a resource. If you're not sure, do I need professional help? Is this normal? Is this too much? Call and talk to an expert and have them walk you through it.
Right,
We've got
exactly.
another question here, Linda. Does MHA offer family services if there are difficulties in the relationship between the caregiver and the senior, or maybe other siblings, family counseling, problem solving for family relationships?
Um, Certainly we can see people in for typically we talk about it as couples counseling, but the couple doesn't necessarily have to be an intimate partner couple. It can be any two people who are in relationship with each other. We don't, what's the word I'm thinking of? Oh, we don't do mediation
Okay.
in that way. But when there are interpersonal relationships that need some support and maybe some uh, objectivity from a third party, yes, we can see people in the counseling services area, or for that matter, we have sometimes we might get a couple and a young adult child or a teenager or even flipping that in terms of age where you know elder mom comes in with caregiver daughter and they talk through what their concerns are and try to come up with some resources. The walk-in folks are really good at kind of helping to look at a situation objectively and help put together a plan that a person can act on. So yeah, they can we
What
can.
I did not know that, Linda. What a great resource. And I know certainly in my experience, communication and the inability to communicate well in the heat of that caregiving relationship, how great to have an opportunity to talk with someone objectively, that both of you can hear at the same time. That's great. Linda, what about crisis management in a family situation? Like if someone needs nursing home care, professional care, is that something that MHA would help with?
We could certainly start the conversation. I would say that if a family is looking for like recommendations on what professionals to contact for those kinds of services, we may refer to MAP or other kinds of senior service specialists. We have a large database of services available to us in the call center and also in walk-in. The database has as a sort of priority purpose identifying resources that are in place to serve certain communities like low income individuals, people with disabilities, categories that are not readily available on the commercial market. So there may be options that are appropriate for some families that are more commercially available, and those are not necessarily the ones that we're going to have the best resources for. So
Okay.
we will
That you would help connect to other
help
folks.
connect.
Yeah.
Absolutely. Yeah.
Mary, I'm sorry, Linda, here's a great question. Has there been an increase in demand for MHA's help, and have additional staff been put in place during the pandemic to help? Are you seeing an increase in requests for service?
We are. Yes, absolutely. And so it's been an interesting thing happening at MHA, part of which was planned already, and part of which has been in response to the increased demand. Um, we we're planning to expand our walk-in services. We originally were available from noon to 8 every day, but we were asked by some providers to expand those hours, and fortunately, with the funding that was necessary to do that. So we had a huge ramp up during the pandemic of our walk-in service. We expanded the number of walk-in crisis specialists. We also expanded to have now a number of navigators, who are people who will sort of provide follow-on support and care to individuals. So if somebody comes to walk in, they work out a plan to get connected to resources, then that navigator will help them, will continue to stay in touch to help them get
Wow.
connected, which is a really nice service. When you're in crisis, it can be really hard to have the focus or energy to make those connections yourself.
Mhm.
And so the navigator, they may not be the ones making the phone call, but they'll be there to support throughout the connection period. So that was happening. We also have, where we can, added an extra person on the shifts for the call center because the call volume went up enough to require that. And our counseling services program has continued in its usual capacity, which unfortunately has led to some wait times for getting connected to counseling. But that's not just us; that has been throughout the mental health industry.
Yeah,
Yeah.
excellent. Folks, does anybody have any other questions for Linda? Linda, I am grateful for your time and for your spirit. And I hope that everyone leaves tonight with some new information, some new strategies to try. One thing that Linda mentioned that I'm going to plug because I think it's so important is support groups. A fantastic way to connect with other caregivers. It is, I know the group that I facilitate, we do a lot of laughing. It's a joyful group, but it's really nice to just spend time with other people who get what you're talking about without having to explain it. Mary Collins from the Division of Senior Services, I know that they facilitate some support groups. The Alzheimer's Association has support groups. If you were to reach out to Mary at the division and ask about support groups, she may, I think Mary has a list. I know she was just researching them the other day. So most of us have pivoted to online groups. You don't even have to leave home. There's also chats and other stuff online. So connect, connect, connect professionally, professionals at MHA, other caregivers, other people, but find someone other than the person that you're caregiving for to talk to. That is really important. So I want to say special thanks to Right at Home, a fantastic home care agency. We'll put their contact information up at the end, and we're grateful for their sponsorship of our program tonight. I mentioned to you that we have, whoops, that we have already looked forward to next year. We've got some great webinars set up already. January 14th will be our next one, and we'll be talking about telecommunication services. I think you will be very surprised to learn about the very free services that are available to you through the state of Maryland if you or someone you live with has communication problems with standard phones. There's a lot of resources out there. So I just saw a quick note from Mary. If you call the caregiver support program at Senior Services, it's 301-600-6001. She's got great information about support groups. And again, 211 is the number to remember for the Mental Health Association. So thank you all very much for being here tonight. I wish you all a pleasant holiday, and we will hopefully see you back in January. Stay safe. And again, Linda, thank you so much. And Right at Home, thank you. Bye-bye, everybody.
Welcome. Good night.